Hey y'all, my name is Morgan Vaughn, and I will be presenting my ADDIE presentation on radiation-induced skin reactions in the course I designed for this project. My project description is that I designed a course titled Introduction to Radiation Therapy, Principles and Practices. The specific lesson that I've chosen for this project focuses on radiation-induced skin reactions, which are skin reactions that patients undergoing radiation therapy treatments will get during their treatment course. The learning challenge of this course is to aid in the understanding of the radiation therapy students of the different types of radiation-induced skin reactions, treatment regimens, and when to discontinue and consult the physician before treating further. The needs analysis for this project: the students will be educated on the different types of radiation-induced skin reactions. The content that I will be covering uses lecture, discussion, and observation in the clinical setting. The students will be going to lecture once a week along with observation in clinic once a week. I intend to be the instructor of this project, and I identified the need. The students will have lecture along with clinical observation once a week, like I mentioned before, and this skill is important for the students to learn in order to appropriately address skin reactions in their professional career, and this is really important to help reduce skin damage, long-term infection, and long-term cosmetic problems. The task analysis: the learner should be able to recognize the different types of radiation-induced skin reactions, also recommend skincare regimens, and decide when to inform the physician of a severe reaction. The students will also have taken 2 years of prerequisite courses such as anatomy and physiology, physics, and pathophysiology before they are admitted to the radiation therapy program. And the diagram here to the left displays the task sequence and the steps of the role play scenario that will help determine if the learner is able to complete the assigned task. It has different roles such as therapist and patient, and it goes through a process of how a therapist would react to a type of skin reaction that the patient will present to them. The learner analysis: the expected age range of these learners is 18 to 33 years old, with a gender distribution of around 75% female and 25% male. Many students will have a background in radiography, which is X-ray, while some may have just the minimum prerequisites of A&P, physics, and patho. The ARRT, which is our accrediting body, just changed the registration to where you don't have to have a background in X-ray. You can have a strict bachelor's degree in radiation therapy, which is what I did. I didn't go through an X-ray program before. The geographical location will also primarily be in the South because of the university's location in Memphis, Tennessee. The students are expected to be from a middle-class background. There will be differences, but that's the majority of the class, and English as a primary language. This is a faith-based institution, so the majority of the students will be of a Christian or religious faith, and the major learning styles that I expect to be prominent in this group of learners, which is usually prominent in healthcare learners, are visual and kinesthetic. The instructional goal and objectives: the goal is that students will demonstrate an understanding of how to recognize and respond to the different severities of radiation-induced skin reactions. And the 3 objectives that I've come up with are: number 1, differentiate between the different types of radiation-induced skin reactions. Number 2, articulate to a patient recommended treatment regimens for radiation-induced skin reactions. And number 3, decipher when to continue with treatment as prescribed or when to consult a physician about the reaction. For the learner evaluations, for the first objective, I chose to be measuring a change in knowledge concerning the radiation-induced skin reactions. This will be measured by having the students match pictures of different reactions to various treatment scenarios. So a treatment scenario would be like saying a patient with fair skin came in for 6 weeks of breast treatments, and the student would have to pick what their skin would look like at that point. And for the second objective, I will be measuring a change in skill concerning whether the students can recommend appropriate skincare regimens for the different types of reactions. And after the student has determined the reaction, he or she can explain to the patient the appropriate skincare regimen to promote healing during treatment. And for the third learner objective, I'll be measuring a change in skill as well, concerning whether or not students are able to determine when they should just continue with treatment if it's a regular reaction, or when to consult the attending physician if the reaction is too severe to continue on with treatment. For the instructional events for Objective 1, went through this 7 steps here. Number 1, we'll review the importance of recognizing radiation-induced skin reactions to reduce inflammation and risk of infection, while also building a clinical relationship with the patient in trust and confidence. We'll also have to inform the learners of the objective, which is we'll just restate the objective and elaborate that there are 4 types of radiation-induced skin reactions. And then for the stimulating the recall of prior learning, we would let each student read over their self-reflections from their clinical experiences. And to present the content, I will make a presentation that will include photographs and descriptions of the different types of radiation-induced skin reactions. And then for the guidance, after each slide we'll have a group discussion regarding the skin reaction we just covered. And then to elicit learner performance, students will role play the therapist and patient interaction. The patient will read over their specific radiation-induced skin reaction, and they will pick a photograph that accurately depicts the skin reaction that would be present under these conditions. And then to provide feedback, I would provide each learner feedback on how they did on the learner performance. For the instructional events for Objective 2, we are going to go through the same 7 steps. We'll review the different types of radiation-induced skin reactions and explaining the importance of how and why you recommend treatment options for the patients. We'll restate the objective and briefly mention that there are different treatment recommendations for each stage of radiation-induced skin reactions. You wouldn't treat them all the same, or the patient would have a worse reaction. And then we'll discuss the role-playing activity where we picked the photograph that accurately depicted each treatment scenario to recall learning from a previous lesson. The content will be presented using the same photographs of the skin reactions that we used in the first activity. Then we'll state the reaction, and I will describe the type of regimen that will be useful for each one of the reactions pictured. And then we will discuss different concerns that the students may have regarding each reaction and treatment regimen. And I will have examples of some of the commonly used over-the-counter products so the students can have a visual representation of the process. We will also continue the role-playing activity, beginning where we left off. The therapist will evaluate the patient's skin reaction and then provide a skincare recommendation. And they can also use the over-the-counter products as props to provide a demonstration for the patient. Then I would provide the same positive and constructive feedback to the learners as they complete that. For the instructional events for Objective 3, we're going to go through the same 7. We're going to explain the importance of consulting a physician when the reaction is at a stage where treatment is considered harmful for the patient. We're going to restate the objective and briefly describe a skincare reaction where treatment would be considered unsafe. We will also discuss any clinical experiences where the students witnessed a therapist going to grab a physician to look at the radiation-induced skin reaction instead of taking it into their own hands to deliver treatment. The content will be presented using photographs used in previous lessons, and I will describe conditions in which treatment is unsafe, such as if the skin reaction has moist desquamation, pus, or discharge. and during the presentation we'll go over each picture and let the students deem it unsafe or unsafe, and they'll have to tell me why each one is in each category. We'll continue where we left off from the role play activity, and the therapist will decide whether to continue treatment or grab a doctor to examine their skin before they receive treatment for that day. And I would also provide positive and constructive feedback during this performance. For the instructional activities for Objective 1, it will be a directed learning environment. The specific objective will be presented through PowerPoint with passive reception, with the pictures of the different types of radiation-induced skin reactions. The PowerPoint will have the content that includes each type of radiation-induced skin reaction and a couple of pictures of each type and the circumstances that would present each radiation-induced skin reaction. For the Objective 2, this lesson will be presented using a directed learning environment. The content will be presented using the photographs that we previously used, and it will be a combination of passive reception and active participation. I, the instructor, will present a photograph of the radiation-induced skin reactions, and the students will describe to me how they would articulate that process to a patient. For Objective 3, this lesson will also be presented through a directed learning environment. The learner audience will recall previous learning to state the type of reaction and how each reaction should be treated, and the new content will be presented through passive reception, and I will explain some circumstances in which it would not be safe to deliver treatment based on the different pictures of the reactions. Then we'll have a group discussion following the presentation of the new information, and we will participate in active learning. For the formative evaluation, I use the approach advocated by Smith and Reagan, and we'll utilize the 4 phases. During phase 1, the design review, we'll focus on reviewing the content to make sure it's accurate and up to date. And then for phase 2, the expert review, I will enlist the help of some radiation therapists and radiation oncologists, dosimetrists, and radiation physics experts to make sure that the content is relatable to the clinical field. And then for phase 3, for learner validation, this phase has 3 parts, which is the one-on-one and the small group, and those will be used to gain feedback, and the field trial will be set at a university, which will include about 30 participants, where we'll do a sample of the actual instruction process. Then for phase 4, ongoing evaluation, I will use a mid-semester and end of the semester survey to gain feedback from the learners. And for the summative evaluation, I'll use Kirkpatrick's 4 levels of evaluation. For level 1, we'll evaluate the reactions of the learners. I'll use an attitude survey with 5 levels of satisfaction ranging from completely dissatisfied to completely satisfied. For level 2, I'll evaluate the success of the learning portion, and I'll use a pre-test and a post-test on radiation-induced skin reactions to prove that the learners have grasped the concept. And for level 3, we'll evaluate the transfer of knowledge from the didactic setting to the clinical environment, and I'll survey their clinical instructors to determine the students are displaying their knowledge of the reactions in their actual real-world setting. And for level 4, the results portion of the evaluation will be determined by the pass rate of the national board exam that they'll take at the completion of the program. And there's my references. So that is it for my presentation. Please drop any questions that you have below in the comment section, and thank y'all for listening.